Local Memphis Live continues with your host, Amy Sparopoulos.
The world was stunned when back-to-back tragic deaths happened of Kate Spade and Anthony Bourdain that revealed the agony and pain that can be haunting people many times behind closed doors. It also highlights the spike in suicides across the country. Here in Tennessee, the suicide rate is at an all-time high, prompting healthcare advocates to really push the conversation. Welcome, Dr. Lora McGill with CNS Healthcare. Good morning, Dr. McGill.
Good morning.
And we were just talking before we came out. In the second leading cause of death in the age group of 10 to 24.
Right.
That is horrifying.
Right.
Wow.
And I think the biggest shocker for us is that it includes children.
That it is.
And I think before we always thought of this as being something that would affect adults.
Right.
Maybe children wouldn't have the means.
Right.
But
right.
they do.
Right. Right. Which tells me that something is. What does that tell you as a medical professional?
Well, I think it tells me that people have more access to not only talk about suicide, how to, go through and follow through with suicide, but also there must be risk factors or environmental things that they're being exposed to that maybe before we didn't have access to. So I think that people see it. I think it's not a fiction about these suicide pacts, about children maybe finding that might be a way out of their problems rather than facing them. And another thing is that people who have good conflict resolution training or I just sort of tools to do that usually don't. And so maybe this young group of people don't have those tools to prevent the suicide and sort of maybe find another avenue. And they're afraid to talk about it, of course.
Yeah, yeah, like it's a taboo subject or something.
Right, and they don't tell because it's embarrassing to tell.
Golly, and I mean, knowing, how does suicide death rates compare to homicides in the state of Tennessee? Do we know that number?
Yes.
Okay.
So we do know that in the United States in general, suicide is more common in middle-aged white males. And I won't say middle-aged because the age group is actually pretty young. It gets started in the 20s and 30s, but it's more common in white males. Okay. And the same thing about black males. It's more common than homicide. So, I mean, so sometimes, we're focusing on the homicide, and of course, that's bad. Yeah. But when you see self-inflicted, it's very, very disconcerting because you think, what could we have done? Yes. How could we have fixed this number? Yes. Just like we're trying to decrease crime, we should also try to decrease suicide and self-inflicted. Of course, self-inflicted deaths.
And I think a lot of times the community, it takes a village, as we were talking about. It's not just one or two people in the home or something like that. We should all look for things and warning signs. Or is depression? I mean, are there warning signs?
Right.
Is it hard?
The warning signs are there. We have to be educated and smart about how to look for them. I think we overlook them because we're not informed. So one of the myths that we probably need to try to dispel is that talking about suicide makes it worse. That does not make it worse. People who would not have considered suicide are thinking about it now because we ask them or we talk about it or we're trying. That's not proven to be true. It actually prevents. So you have to be able to talk about it, I think, to make an impact. The other thing is that there are some high-risk groups. So we talked about the young group, the age 10 to 24, and then there's the 25 to 30 group, but the higher percentage of suicide actually is in elderly. So the elderly population is at great risk of suicide, and we tend to estimate that.
Absolutely.
It's not flashy, and it's not, probably going to be the ones that show up on TV, but it's a high-risk group. And we know that depression is highly associated with suicide as well as substance and alcohol abuse. Alcohol abuse is probably top. People who struggle with that or substance abuse in the past are at very high risk of committing suicide.
And we talked about something. You said if you suspect, don't wait to say something. It's better to say something.
Confront.
Than
not. You'd be surprised, actually, the number of people that you say, have you had thoughts about harming yourself? Or even simple things like, have you thought that maybe you'd be better off not here? Or have you thought it'd be okay to fall asleep and never wake up? You see, because that's an earlier sign maybe before a person moves to a plan and intent.
Right.
So there are lots of little steps along the way, and that's why if we confront early or say something right away, or somebody says something that sounds a little suspicious, you know, right then and there, just confront, call for help, ask someone, say call this number.
Absolutely. And speaking of that number, there is a 1-800 number, 1-800-273-8255. That's the National Suicide Prevention Lifeline. Again, the number, we'll have it on our Facebook, and I'll list it on all of my social media pages, because I really think, I'm so glad that you said that, because really I think talking, conversation, because you just never know what's going on in someone's life. And I think if you prompt and continue the conversation, perhaps you will get some input into that.
Exactly. It makes an impact for the person who's suffering, and it gives us, as the people who are on guard, you know, some tools to work with to feel like you've at least tried.
Absolutely.
You may not prevent, and that's a tragedy when you feel like, I didn't prevent it, but you can at least try to make an impact.
Okay. Dr. Lora McGill with CNS, thank you so much, my friend. So great to see you. Coming up, Mid-South kids head back to class, but first, we are helping to arm them with the school supplies they need, how you can join in the mission, and help make sure they can soar right off to the classroom after the break.